That's what I was waiting for. I'm
Okay.
like, you didn't give me my little announcement. Okay, so I'm so excited. So, of course, you all know that this is our bi weekly virtual support group. And this is all about trying to provide just a safe space, resources, information, again, collaboration, just a place to kind of talk about our experience as caregivers and to get information and just find out things maybe that we weren't aware of before. So what I wanted to do is I received some additional training and the team and I put together a presentation to really just kind of make it even simpler, just some of the things that we commonly go through when it comes to dementia in our loved ones. So kind of understanding it, some of the challenges, how we can work around those challenges. So, again, as you're watching this, if you think of questions, some of this is going to be repeat information, but again, it may just help answer some questions or even just give you some comfort in knowing that you've been doing things the right way. So, I am going to go ahead and share my screen. Um, so, okay. And there we go. So I'm going to go ahead and put it on. So hopefully you all are seeing the screen, the
Hmm.
actual presentation.
Yes.
Okay, awesome. So of course this is understanding dementia. And as I said, as we go on, feel free to kind of jump in with questions, thoughts, concerns. But for starting off, we're going to talk about first of all, our commitment. So, again, this is brought to you by My Natural Me, specifically our program, which is the Dementia Caregivers Support Program. And we are committed to providing that comprehensive and compassionate support to caregivers of people with dementia. We believe that everyone deserves to have the support they need to provide quality care for their loved ones. One of the things on this point here, one of the things that they found when they started doing some research, even for people who have dementia, the aging and abuse and violence sometimes that these ones get. And what they found is that oftentimes when they have been, say, abused or maybe treated in a certain way, it wasn't necessarily that it was intentional, the caregiver was intentionally trying to hurt their loved one. But what they found is that sometimes because they were so stressed and so just mentally taxed out and hadn't gotten ways to help themselves, that they basically just kind of lashed out. And so that's another reason why our program is designed to help caregivers to be able to cope, to not just improve the quality of life for their loved one, but for themselves so that everybody wins. So we're going to kind of go into what is dementia. And again, this is something that we've talked about before, but again, I want to really talk about and highlight what dementia is. So, dementia is not a specific disease. And I think that's one of the biggest misconceptions out there. People don't understand what dementia is. They look at it as a disease itself, but it's not a specific disease, but actually, it's a general term for a decline in cognitive ability. That's a very simple way to look at it. Some of the symptoms from that are memory loss, confusion, impaired judgment, and personality changes. Some other things, and again, this is information that we've talked about before, but people will sometimes say, well, I don't know if they have Alzheimer's or if they have dementia. But dementia, again, is that blanket term. Alzheimer's, vascular dementia, Lewy body, these are the types of dementia that a person can have. And if you've come to these support groups before or you've heard me speak about this, it can be likened to when a person has cancer. Oftentimes, if a person comes up to you and says, I have cancer, one of the first things that you're going to probably ask is, what type of cancer? Is it breast cancer? Is it colon cancer? And the reason is because cancer is kind of like that blanket term, right? But depending on what type of cancer a person has will depend on what type of treatment they need, what type of medication they need. And it's very similar with dementia. Understanding the type of dementia that a person has can really help everyone, the medical team, caregivers, really help them understand how to treat it. So as we dig a little deeper, this next slide, it can be, some people have different emotional responses to this next slide because this is such a powerful visual aid of showing the difference between the brain, the healthy brain on the left, and on the right is a brain of a person who had Alzheimer's dementia. And why we like to show this image is because so many times caregivers, they only are looking at the external, right? This is mom, or this is husband or dad or sibling or whomever, right? Grandmother. So they're used to that person being what they've always been to them. But looking at this image, this sometimes can really drive home the point of understanding why your loved one is limited. Because clearly, when you see that brain on the right compared to that brain image on the left, there's really no doubt that there's going to be some interruption in cognitive ability and other type of things. So I'll pause right there and just ask, does anyone have any thoughts or questions just on this picture alone? Is this hard to view? What is your thoughts? You can just go right on, call right
Okay.
on.
It kind of makes sense though, because when you think about it, their ability to think as they normally would has changed. So it's not just the behavior, but the capacity of how they're able to think and process things. So that really sort of drives the point home and helps you to really see, wow, what a difference.
Yeah, yeah. And I think it's a good one too, because again, especially sometimes the older generation that are caregivers, um, they can really believe that the person has more ability to monitor and correct their behavior than they have. So sometimes you'll find them saying, "Oh, she can help it. Come on, you remember," and they'll keep on. But again, having a visual aid like this just kind of can help drive home the point that no, they are limited. This is a physical and chemical illness that they're dealing with. So now, as I mentioned, there's different types of dementia. There are actually over 100 different types or causes of dementia. But right now, there's kind of four main ones that the medical world really addresses most often. So those are the ones that we're going to talk about today.
Lita, one
Yes,
question.
absolutely.
Timberly, Timberly Johnson is on with us too, but she's driving, so it's affecting her ability to be able to make any comments, but she can hear. She
Oh,
asked the question, if the two brains that you had up there before,
mhm.
does that mean that the brain is physically shrinking?
Yes,
Okay.
yes, yes. Isn't that sobering? Yeah. That's exactly what that means. Great question. All right. So and again, that's perfect, just like you did. Just jump in. If she's able to get questions to you, just
Yeah,
jump
she's
in there.
texting me.
Okay. Be careful driving. So when we talk about these four types, the four types that you'll hear most often, Alzheimer's, which we all are familiar with, frontal temporal, Lewy body, and vascular. These are the most common types of dementia that are out there today. Now, as I mentioned, there's close to 100 different types. There's types of Parkinson's disease that can cause dementia, and a number of other things. But we're going to just kind of focus on these four because most dementia as of today falls in one of these categories. So we'll talk a little bit about Alzheimer's, which is the most common, and this information that I'm sharing regarding the Alzheimer's is coming directly from the Alzheimer's Association. Now, I will use a bit of a caveat when I say it's the most common, and it's the most common because the organization itself has the most money to provide the most resources and testing and education. So for now, it's the most common, but a lot of research is being done, and they're saying some of these other ones might even be more common. And we'll talk about one in particular that they guesstimate might even be very much under accounted for, if that makes sense. So talking about Alzheimer's likely develops from multiple factors such as genetics, lifestyle, and environment. But I'll pause there for a moment because it's important to note age is not just because you're aging doesn't mean you have the memory loss that is associated with Alzheimer's disease. So that's very important to note, because sometimes when a person starts having the symptoms of Alzheimer's dementia, they are typically a little older. And so sometimes family and friends and loved ones will assume, well, they're just getting older. This is just common. No, memory loss and cognitive impairment from Alzheimer's dementia is not common to old age. However, an older person is part of the prerequisites for getting it. So it can be a little confusing to understand, but I think that's just something I want to kind of put like a little note for yourself that, that's not just necessarily just because a person is at a certain age doesn't mean that the behavior you're seeing is equating from them being older. Does that make sense?
Mm-hmm.
Okay. Mm-hmm. Symptoms: memory loss of newly learned information, short-term memory, cognitive decline, confusion, difficult with daily tasks. Now, again, I emphasize that piece there because when you are the loved one and you're caring for someone with Alzheimer's dementia, especially in the early to mid stage, that piece right there can be so confusing, because they might be able to tell you something that happened 10, 15, 20 years ago, like it happened yesterday. Yeah. But they will keep asking you the same question. They'll keep, looping with something they're talking about, right? And you're like, how is it that they don't get it? Like, you just asked me that, right? Or they'll say, where is so-and-so, right? So especially in the early to mid stages, you'll see that newly learned information, short-term memory is the first to go. That long-term memory stuff from way long time ago, that sticks around a lot longer. And just as a note to that, what they have found is that even with the long-term memories, the ones that are the most resilient are the ones that are associated with emotions, which is why they find that playing music and things like that tends to bring those memories out, because we're so beautifully created that music piece of our brain, right, attaches, it's almost like it seals emotions all in there and keeps those memories very protected. So it's again good things to note when you're thinking about your loved one and understanding, right? Because this is what this is really all about, trying to understand what they're going through. And then as Alzheimer's advances, as it brings out in the third square, it does increase and lead to increasingly severe symptoms. So we're talking about disorientation, mood and behavior changes, deepening confusion about events, time, and place, unfounded suspicions about family, friends, professional caregivers, more serious memory loss, behavior changes, difficulty speaking, swallowing, and walking. So Alzheimer's is a progressive dementia, and it will eventually get to the point where even most memory function, most cognitive function, you'll find has declined. So again, that's pretty much kind of common for Alzheimer's dementia. I'll pause there. Any questions specifically about Alzheimer's?
No, that really clears it. That is actually great because, I think for the longest time for me, just really being able to distinguish the two and having you explain dementia, like Alzheimer's is a part of dementia. It's like a phase one of of dementia. So I think for the longest time for us, we were like, my family meaning, it was like really trying to understand the distinction between the two. And it's
Mm-hmm.
not really necessarily a distinction, but just the tier as far as where the person is, it sounds like.
Yeah, you can look at it as the cause, right? It's the
Hmm.
cause
Hmm.
of dementia.
Gotcha.
And the cause itself will advance in symptoms. So again, I go back to, if you can always remember, go back to thinking of it like cancer. If a person has breast cancer, right? Breast cancer has what? Stages, right? So that's
Gotcha.
how you can
Hmm.
look at Alzheimer's. It has stages, right? The cancer itself is like the dementia, but the specific breast or colon or pancreatic, that's how you can look at these things we're talking about, Alzheimer's and the other ones we'll talk about. So excellent, excellent. Any other questions before we talk about the next form? Okay. So I'll move on to the next one. Now, this one is the one I was saying, um, they're finding that this one could be very under accounted for. And the reason why is because frontal temporal dementia is actually affecting younger people. So some of the early stages of dementia, they're finding people 45 to 64 years old are getting this type of dementia. So let's start at our first box. What is the cause of this one? This one is the result of damage to neurons in the frontal and temporal lobes of the brain. Now, if you study the brain and you're fascinated like I am, once you kind of learn this piece, it makes sense some of the symptoms that you see from it. Because as it says here, some of the symptoms include unusual behavior, emotional problems, trouble communicating, difficulty with work, or difficulty with walking. So, this is why this one is sometimes a little difficult to diagnose because a person may be, let's say, in that age range, 45 to 64, and they're just acting different. They're demonstrating emotional issues, or maybe they're being very inappropriate. It's like, why is this person being so inappropriate in their words or behavior? Maybe they're just not even communicating the same way, or you're talking to them and they even seem kind of emotionless. Well, that's what this particular type of dementia can bring on. The reason why, because it affects the frontal lobe. So if you want to do it on your own, again, if you're kind of like a brain nerd like I am, it's fascinating. If you look up some of the parts, some of the things that the frontal lobe brain controls, and then it's like that makes sense that those things would be compromised if there's an issue with that part of the brain. Key characteristics, it says it is rare. And again, we have to kind of put a quotes around that because it's rare because that age range, that it's hard to diagnose this type of dementia. So they're doing more tests and studies to see, and they feel like they're going to find out that this is much more common than they thought. Um, but again, this is for information. We in our support groups in our Facebook group, we have people who share that their loved one has been diagnosed with frontal temporal dementia. So it's good to just understand what it is, what the symptoms are, and again, knowledge can bring about one of inner peace, right? When you kind of know what's going on, and then it also can help you know what steps you need to take. All right, so now we're going to go to Lewy body dementia. This one is a really interesting one. So the kind of technical terminology, the cause is a disease associated with abnormal deposits of protein called alpha synuclein in the brain. That's what I'm going to call it. These deposits, called Lewy bodies, affect chemicals in the brain whose changes in turn can lead to problems with thinking, movement, behavior, and mood. Some of the symptoms are changes in thinking abilities. It says these changes may include visual hallucinations or seeing things that are not present. Unpredictable changes in concentration, attention, alertness, wakefulness from day to day. It says sometimes throughout the day, ideas may be disorganized, unclear, or illogical. Here's a difference, and this is again something to note. Unlike in Alzheimer's dementia, memory problems may not be evident at first, but often arise as this progresses. Now, that's really, really key if your loved one is showing these symptoms. Why? Because when in your mind you think of dementia as memory loss, right? That means as caregivers, we think we have to do things to fix the memory loss or help the memory loss. But in this type of dementia in early stages, they don't necessarily have memory loss. But imagine if it's affecting their ability, when it says disorganized thinking, imagine, just put yourself in their place for a moment. Imagine you know what you want to say. You see your loved one, and in your mind, you think, I want to tell this person I love them. But somehow, between it coming from your brain to your mouth, it gets disorganized. And so you might say something that completely doesn't make sense. Well, if the person, your loved one that you're talking to, thinks you have Alzheimer's, for example, what are they going to think just happened in that moment? What do you guys think? They're going to think you forgot who they are, right? Because they're thinking dementia, they must not remember. So imagine you're the caregiver of someone like this. Just imagine the frustration that could happen, right? This person knows who you are. They know your daughter, sister, aunt, cousin, and they can't say it. They can't respond because their thoughts are disorganized. So you're saying, it's me. I'm your daughter. And they're in their mind, they're like, I know you're my daughter, right? So this is just a good way to understand why it's important. I can't stress enough for you to make sure you find out what type of dementia your loved one has, because without that knowledge, you might be going about thinking you're solving problems when you're making them worse. Go ahead, Elaine.
Can the symptoms overlap from the different types of dementias?
Yes. Yes.
Okay.
Now, especially in, like this says, for example, with memory loss, later stages of Lewy body will have memory loss like Alzheimer's does. So some of these different ones are going to overlap, but that's why it's really good, and we'll talk about it a little bit later, why it's really good to get these doctors to do the examinations, to get them to neurologists, because exactly what you're saying, Elaine, depending on where they are, they could be presenting some similarity to another type of dementia. So you wouldn't know, but it's good for you. These neurologists, these doctors, they know how to provide the testing that can at least narrow it down to give you a better educated guess as to which dementia they have. Great question. And then last is characteristics. It says refers to either of two related diagnoses, dementia with Lewy bodies and Parkinson's disease dementia. So again, that's something that a lot of people aren't aware of, that Parkinson's can also be a type of dementia. Both diagnoses have the same underlying changes in the brain, and over time, people with either diagnosis develop similar symptoms. The difference lies largely in the timing of cognitive thinking and movement symptoms. So again, you may not walk away remembering this specific thing, but the real importance of this is why you need to go to the professionals. And as I've mentioned before, unfortunately, they're not quick to give you this information. They're not quick to do these testings. I'm sure it just comes down to money and funding and time and all of that. But if you put the pressure on, they will. If you put the pressure on, they will write the orders and the referrals for you to talk to these ones that test for these things and give you a better understanding of what your loved one's dealing with. Our next one, our last but not least, is vascular dementia. Now, this is caused when different conditions interrupt the flow of blood and oxygen supply to the brain and damage blood vessels in the brain. So I know in some of our support groups, for example, we've talked about ones that had strokes, right? They've maybe had a stroke or maybe they fell. So these things, right, as trauma to the brain has caused some type of lack of blood flow. Let me let someone in. I think I got them in here. Yes. So with vascular, as I was mentioning, this can come from some type of damage to the brain where there is a lack of the flow of blood or oxygen. And it's so those blood vessels in the brain get damaged. Symptoms with this: difficulty performing tasks that used to be easy, such as paying bills, trouble following instructions, learning new information. So Elaine, you mentioned, can they overlap? Remember, we talked about that with Alzheimer's, right? So that's also vascular and Alzheimer's are very, very similar in symptoms. As you'll see, forgetting current or past events, misplacing items, getting lost on familiar routes, problems with language, such as finding the right word or using the wrong word, changes in sleep patterns. So again, I'm going to keep stressing, get the testing done so you have a better idea. Now for this, for example, when you are taking your loved one to get these tests and to find out what's going on, things that will help clear up if this is the type of dementia they have will be things like an MRI, CAT scan, right? Those are two very, very important tests. If your loved one has been diagnosed with dementia, one of the first things you want to do is have them get this MRI and CAT scan. Now, in most cases, your regular doctor is going to have to make, I will say this is kind of in general what happens. Let me let someone else in. In general, your primary doctor is going to make a referral to the neurologist, and then the neurologist will order the CAT scan and the MRIs. Now, in different states and locations, sometimes that can change, but it typically starts with your primary care doctor. And I'll pause for a minute. Has anyone had challenges when trying to get this information, get this testing done? Elaine, go ahead.
In the beginning, initially, when we were trying to figure out what my mom had going on, it was difficult with her primary doctor to step up. She kept saying, well, she's getting older. This is just normal. But I knew something was wrong. So I switched doctors. And then that second doctor that we got, he referred us to the neurologist. So we were able to, from the CAT scan and the MRI and some other testings that he did, found out that she has vascular dementia.
See? So that's an excellent example of exactly what we're talking about. Unfortunately, majority of cases that we hear about, that the doctors are hearing about, neurologists, it's very much a disconnect, and you have to be informed and educated and go in saying, I need this testing, or I need a referral to the neurologist, or what have you. Now, here's what's interesting. As we said, it's good to know the type of dementia because that can determine the treatment. Now, notice this last box. It says, because many different disease processes can result in different forms of vascular dementia, there may not be one treatment for all. However, Vascular dementia is often managed with medications to prevent strokes and reduce the risk of additional brain damage. So again, this is good information, right? Because, and I'm sure at least one person on tonight's call has experienced this. You go to the neurologist, you have the diagnosis of dementia, you explain symptoms, all of these things. Maybe they're having hallucinations, they're getting lost, whatever the case. And the neurologist says, we've got a medicine for that. And many times it's an antipsychotic medication. Well, as we just saw, and this is taken directly from the National Institute on Aging, one of the medications that's best for vascular dementia, that can be best, is to look into medications that are going to prevent stroke and reduce the risk of additional brain damage. So again, imagine if you don't know this information and you're getting an antipsychotic medication that actually may do more harm to their brain because of the type of dementia they have. So that's why it's key, very key. Again, I keep stressing to arm yourself with the information, ask the right people to get the right things. Any questions on any of this or comments? And I want to welcome, I know we had a couple new people join, so I want to welcome you. Feel free to jump in. So with that said, we'll move now to receiving the diagnosis. This is always can be the hard part when you get that diagnosis that your loved one has dementia. But it doesn't have to be overly scary. So let's talk about some of the first steps that you want to do. Seek medical evaluation when noticing dementia symptoms. Okay, so this is why we said no longer, and even if you're already dealing with your loved one who has dementia, please share when someone comes to you and they're like, I think my mom, or I think my aunt or my grandmother, they've been doing this. So-and-so said they're just getting old, that type of thing. No. We want to make sure we get them to a medical provider right when we start seeing those symptoms. You want to consult a neurologist, a geriatric specialist for a comprehensive assessment. You want to rule out other conditions, and this is something that a lot of people aren't aware of. There are a number of other conditions that mimic behavior of dementia, such as vitamin deficiencies. Did you know B12 deficiency can mirror symptoms of dementia? Thyroid problems, infections. We've talked about this before in our groups. UTIs are big ones. Off so many times when, especially when it's all of a sudden, right? So, excuse me. I'm gonna need to pause one second. There we go. Excuse me. About a couple of months ago, I had pneumonia. And I've noticed that ever since then, if I talk a lot, I don't know, I just kind of get a cough flared up. So apologies for that. And let me see, did I actually start recording? I think we're still recording. So again, these type of situations that can mimic dementia behavior. UTIs are very, very common. So again, if your loved one, even if they have already been diagnosed with dementia, But let's say they seem to be all of a sudden acting even more out of behavior. Like all of a sudden they're having even more strange, maybe it's hallucinations, or they're just all of a sudden something just seems different. Again, you want to take them to the doctor because, again, they may not be able to express how they're feeling. They may not be able to express that they feel off or something's wrong or that they didn't take the medicine like they were supposed to, or all these things, right? So you want to definitely make sure to get them checked for that. Any questions on that? Now, we want to go next to the types of providers. This right here is golden. Whatever stage that your loved one is in with dementia. And I just want to make sure, hold on one sec. I want to make sure that we're still recording. I think, yeah, okay. So you want to make sure that this list here is your friend. I posted this in the Facebook group, so if you're there, you should see it there. I'm happy to also send a copy of this, and I'll actually probably send a copy of this out anyway, so you can have the information. But the types of providers, we'll take a moment to kind of review this. Geriatricians, and again, forgive me if I mispronounce the words, but like it says there, this is a medical doctor, obviously with experience in geriatrics. This is a favorite of many people. A lot of people prefer to have their loved one, especially if they're older. They're like, let's get the regular provider. I want a doctor who specializes in ages 65 and over. They are likely to understand dementia more than a typical medical doctor or physician. Same with the next one, gerontologist. This is just like a geriatrician, but sometimes they are more research and academic focused. So again, let's say you've gone through maybe getting some of the different tests done, but you're still not quite comfortable with the information you're getting back. You may want to look into talking to one of these because they're going to have this is all they do, the research, and so they might be able to really figure out, okay, well, what their behavior seems to match this type of thing that's happening with the brain. Again, neurologist, I'm big on recommending always include neurologists in your medical care team because that's the one who literally has the expertise in the different types of dementia, treatment options available. That's what they do. They know the brain. And then it goes on to neuropsychologists. Again, what I like about this is they're good with the testing piece. So if there's more testing to be done and different cognitive tests, they're really good about making sure those get done. And then this last one, geropsychologist, very similar, except again, as the word indicates, they work with older people. Any questions on these? Okay, let's quickly go through steps after diagnosis. Okay, here are some important things because again, when you get a diagnosis of dementia, that your loved one has dementia, it can feel very scary and overwhelming. And as many of you know, the whole reason why I started this program and added this program to my nonprofit was because when my mom got diagnosed with it, we were clueless. We really just didn't know what to do. So through research and digging, and fortunately I had connections because I already had a nonprofit organization and had relationships with therapists and different people in the community. We were able to get her the help that was needed, and just started working with the Alzheimer's Association and different organizations that really dig deep into the world of dementia. So we put together a couple of just key things that you want to do. These are the first kind of 4 things you really want to do. First of all, you have to talk with your family. And I know Ruby and I talked about this before because this can be hard. In every family, there's dynamics, right? There's typically the one who takes charge or the ones who are more, maybe they're more financial focused, or maybe ones that are more, you know, I don't know, just different focuses and different personalities. And typically there's just different roles that you've had in the entire time in your family. This is something you don't want to wait on. The person who normally is kind of like that person that goes strong and takes care of things will probably be the person who starts the process. But you don't want to just leave it there. You want to make sure the entire family is on board. Some are going to resist because this is a hard thing to accept. So we recognize that. We recognize that people have to kind of accept it as they can. However, the sooner you can get the care planning and communication together, a comprehensive caregiving plan with everybody involved, the sooner you can do that, the better it is for everybody. Number 2, support. Collaborate with healthcare experts to develop a comprehensive care. Again, you'll see that comes up in just about everything I talk about. It's so important to have a strong medical team, which again, often includes your primary care doctor, the neurologist, in some cases, therapist, right? But that's kind of like your top 3. Someone who's understanding just regular medical. This is the person when mom seems like she's a little off today. Okay, let me take her to her doctor and get the UTI test. Let's get blood. Let's get the A1C, diabetes. Let's get all that checked. So that's your primary doctor. Neurologist is typically someone you're going to see every 3 to 6 months. They're going to do this testing again. How quickly is it decline? Is she declining? How stable is she? Is she starting to exhibit signs of hallucinations? That's what that neurologist is going to do. And then that third person, as I said, is usually someone who can kind of help bring the medical side with emotional side and kind of bring that together. So that's kind of like your 3. And then that list, as I mentioned before, any one of those is also great. Legal and financial planning. This is super important. Why? Because as the disease progresses, when they become to the point where they cannot make sound decisions, it can be a nightmare trying to then handle legal affairs, finances, their home, excuse me, all of these things. You want to start right away. And it can be very uncomfortable, very difficult to have these conversations, but you want to have them as soon as possible. You want to get someone to be the power of attorney that your loved one feels agreeable with. Now, I know our loved ones can be tough and they may not want to give up certain power, but those again things you'll work out with the team as far as how to explain it, how to do it in a way that doesn't make them feel like they're losing all identity, right? But you definitely want to get this done right away. And then acceptance, acknowledge both the diagnosis and the associated challenges. That's the hard part. But the sooner you, as the caregiver, can accept what this is, what resources you have, and what you need to do, believe it or not, this can really aid in your own peace of mind and well being. It's going to be tough, but this can help you as the caregiver and your loved one, because the other thing to remember is while their cognitive may be declining, they're still very good with picking up visuals, right? Visual clues. So if you're irritated, if you're sad, because think about how the brain works, it works to compensate when one area goes down. So if they see your emotional face change and things like that, that's disturbing to them. So just always remember that the more you can accept and do what you need to do to take care of yourself so you can be in a good state of mind for them, the better the experience for them. And as we say in our program is we're creating moments, not memories. And that can be a hard shift, right? Because we tend to think, oh, let me take pictures. I want to be able to look back at this. Think about the moment. You want every moment with your loved one who has dementia to be a good moment, a quality moment. So we're creating good moments, not memories. So let's talk briefly about coping with aggressive behavior. Now, this might seem very simple, but when we all know when you're in the moment and your loved one is going through all the different things that they may go through, depending on what type of dementia they have and where they are in their stages, right? It can be hard. So we're going to quickly just talk about what not to do. Do not argue or confront the person. Avoid physical restraint if possible, and don't take aggression personally. Now, again, this is much easier said than done. Much easier because it can be, especially if they're kind of sassy and they're fighting you, and then they're, especially if it's a parent role or an authority role that you've been used to, it can be easy to kind of get like, well, I'm trying to help you, right? Like you can get in your feelings, right? So, but this is going to be really key. Again, that picture that we saw earlier where it showed the two brains, hopefully that visual can kind of stay with you where you can just remember they really can't help it. What good is arguing? Because again, now it's taking away the quality of the moment, and I'm not going to actually get anywhere by arguing. And we said avoid physical restraint if possible. When do you think it may be possible? It may be necessary to have physical restraint. Anyone can just chime in.
When they're getting ready to hurt themselves.
Mm-hmm. Yeah. Now here's another point that I received in the most recent training I did, and I love the way that it was explained, because often as caregivers, we're also thinking, sometimes we get hurt in the process. Let's say someone's being aggressive, you go to grab them and maybe they claw you or they bite you because now they're feeling trapped, and think about it, they don't know what to do, they don't know how to help themselves. You want to make sure you keep yourself safe. And that can be tough, but if a person, you have to assess the situation. If your loved one is doing something that could harm you, right? Because you mentioned if they hurt themselves, that's our loving heart. We don't want them to hurt themselves. But if they're doing something that could hurt you, this is a time where you also would want to use physical restraint to keep yourself safe. Does that make sense? Any questions about that?
What are other things besides, give me examples of other things or suggestions when they become agitated or violent?
Yeah, so it kind of talks about it in the second on what to do. So, especially number 2, use calm and reassuring communication to prevent agitation. Now, excuse me. Now, what I don't have on this list is diversion. And I will go back and add that, because that is a very powerful tool, diverting them. We've talked about it in our support groups before. If you think of your loved one as a child, and I know that's hard when it's mom or dad or grandma or aunt, but you have to remember their brain, their cognitive abilities has gone back to a child. So they're easily distracted, right? Just like a small child is easily distracted, right? You try to keep them focused. Our loved ones become like that. So if they're getting aggressive, and it's safe to do so, they're not harming, they're not causing danger to you or to themselves, you want to use some distraction techniques, right? Someone in the group today talked about their loved one is sundowning, which for those, if you don't know what that means, that typically is just meaning that in the evening when the sun goes down, the chemicals in the brain change. Our body, that's how our bodies are, right? Our bodies chemicals change throughout the 24 hours. When people with dementia, they notice that change can cause what they call sundowning, which means that they see more aggression, or the symptoms are exaggerated during those evening times. So one lady said that her mom was thinking home wasn't safe, and so she was trying to leave out of the house during this time. So what she did is she was like, "Can you help me with the laundry?" And mom just went on and okay, so they're folding clothes. So things like that, that can be a good tool. Now, sometimes if they really feel frightened or afraid or some type of strong emotion, um, where number 3 goes in, identify and address potential triggers for aggressive behaviors. So you also have to think about that. What could be causing my loved one to act like that during this time? Prevention and eliminating what's triggering that behavior could be your best bet. Does that answer it, Elaine?
Yeah, kind of, sort of. Because it's two different issues. Because we have a very close friend who has dementia, who's younger than my mom, and then we have my mom who's 89 with dementia. So they're at extreme stages, and quite a few of us are trying to help this other friend who we're close to, but there's issues with having, family support, and and with the with each of us who are helping us, she treats us differently. So some of us she's more agitated with, others of us she's fine, so it's like I'm trying to ask questions to help, but then it's different situations that are involved, so it's probably a one-on-one needed.
Sure. Yeah, and we can set that up. But I think the biggest thing I can really recommend in situations like this is it's kind of tough because earlier we said we have to look at them like children and we have those images of the brain so we understand what's going on. But this is where empathy really comes into play. And I remember one time I was actually getting training for crisis hotline certification. And one of the instructors gave one of the most beautiful illustrations to explain empathy and sympathy. And that was sympathy is seeing someone sitting on the curb in the gutter and feeling really bad that they're in that situation. Empathy is getting down beside them, sitting beside them in the gutter, and seeing the situation from their vantage point. So I always love that illustration because that's true. Empathy is literally putting yourself in a position to see things how they do. So, what I encourage people when dealing with our loved ones with dementia, I want you to put yourself in their position. Imagine all the things you can do now. You're free to go. Think of all the things you enjoy doing, your hobbies, your independence. And I want you to think about that feeling of not being able to do that and not knowing why. And the insecurity that may come, the doubt, the frustration, right? So often when you can kind of think of it from that way, it really does help you come up with creative ways to deal with these aggressive behaviors because the aggression is coming from fear, anxiety, frustration, sometimes embarrassment, sometimes even pain. Think about if, and again, we have to keep it real. Imagine if you use the bathroom on yourself, right? And there was no way for you to let somebody know what you're going through. And you're trying everything you can to fix this problem, but you don't know how. Can you imagine what kind of aggression? And imagine, because this actually happened in the assisted living program that I was in. This lady, she would go, she was not she couldn't really communicate, but she would just walk and she was, she seemed pretty independent. Well, she would go in, as she was walking, she would start putting her hands like in her pants and just like fidgeting with it. And some of the nurses would be like, stop so and so, don't do that. Keep, don't do that. What they learned is she would start doing that when guess what? Of course, she needed to use the bathroom, or if she had used the bathroom on herself, right? So again, sometimes it's just thinking beyond the irritation that their behavior may be causing and think, well, why would a person do this, right? Why would so-and-so try to bite me? What is it that they feel that would cause this reaction? Maybe they feel threatened. Maybe they're in pain. Maybe when I'm touching their arm, it hurts, right? So all those things, I think the biggest thing to take away from this point is try to have that empathy and think why. Why do they have this behavior? Seldom is it just because they just want to be angry. It's almost always because there's something underlying going on that they don't know how to communicate other than that aggressive behavior. Hopefully that helps. Okay, I'm going to move on. So we're going to talk about self-care for the caregivers. And this is so important. Can't stress enough. Caring for yourself is just as important as caring for others. Now, I'm not even going to put anybody on the spot and ask you to raise your hand the last time you did something for yourself. But I want you to think about that. If you're a caregiver, if you're here even because you want to help someone else who's a caregiver, I want you to think about that. What do you do for you to build you up, to make sure you're okay? Give yourself the care and attention you deserve by taking breaks, asking for help, and keeping yourself healthy. Just like we talked about those regular doctor's appointments for your loved one, you need to be getting them too. You need to be regularly getting your blood work done. You're making sure you're okay, because stress can do a number on you, right? So you want to make sure you're okay, right? You can't help anybody else if you're not okay. And we trick ourselves into believing we can because we love these people. We want them to be okay. We got to first take care of ourselves. Join caregiver support groups, as many of you have joined ours, where you can get emotional support and tips and tricks to make your caregiving journey a little smoother. Okay. A few other ones we'll talk about briefly. Incorporate regular exercise into your routine. We talked about that. And, I've probably used all the excuses in the book that are out there as to why I can't exercise on certain days. But I'm telling you, there really is always a way to get some exercise in. There's YouTube videos, there's walking outside, there's dancing with your loved one if they're still mobile, right? Getting someone else to just come over 15, 30 minutes a day. You'd be surprised what that can do for your own health. Excuse me. Ensure that you schedule and attend routine medical appointments. We talked about that. Avoid isolation and prioritize spending time with loved ones. That's so key. And then take advantage of opportunities to spend time in nature, and then consider sharing these experiences with those closest to you, right? Because you still need healthy conversations and adult conversations, right? So you're dealing with your loved one, and all, depending on what stage, that communicating with them can take everything out of you. It can take everything out of you. So you want to make sure you find those times to have just your own time, right? Your own conversations and fun times. Resources and support. As I mentioned, the Alzheimer's Association has great information. You can always go to their organization in Northern Virginia. We have RAFT, which if you're in the Northern Virginia area, it's a great resource program. They even, when you have a new diagnosis, I want to say it's 12 weeks, that they will actually have one of their people sit down with you and go over a lot of what we talked about. They will help you. Okay, so here's the doctors that you can go to. Here's what you want to do next. So that's a great program. It's something that we're hoping to actually even be able to incorporate in our program. Local support groups, and then online resources and education materials. Those are always good as well. And conclusion, while dementia can be daunting and difficult experience, with empathy and assistance, both caregivers and individuals with dementia can lead rewarding and meaningful lives. And then thank you for your attention and participation. Of course, our organization, mynaturalme.org. Once you go to the website, you'll be able to click right on the Dementia Caregiver Support Program. and find out about various events and things that we have going on. And so with that said, are there any questions? I'm going to stop sharing the screen. So any questions, thoughts, concerns? What did you think?
I thought it was
Very
very
nice.
informative.
Indeed.
Awesome. So as I mentioned, I'm here. We have the Facebook group. Again, as we grow, we're going to be doing a lot more. So I will keep you, like you all did, I'll always send out the emails with information, updates. We are going to be doing something fun November 28th. And I know most of you are not in Northern Virginia, but we are going to be trying to do this throughout the year. But in Manassas, we're doing like a pop-up shop boutique. So you can come out. Everything will be $5. And we have all sizes, clothes, shoes. So it's just a way, again, for trying to help our caregivers be able to get out, do some shopping. And we're opening it up to women just in any way, like in need, So if you know of people, spread the word. I'll make sure to send the flyer and information. And then the money that is raised from that will go back into our program. So hopefully we can continue to be able to do even more. So yeah, that's it. I'm so glad y'all
says to say thank you too. She couldn't get on the Zoom actually, but she was texting me back.
Oh, good. Okay.
Nice.
So awesome.
Well, real quick question. What's the Facebook group? I've been looking for it. Is it under?
It is Dementia Caregivers Support.
Gotcha. Okay.
Did you see? Okay, because I was going to say I could. Oh, there we go. I could probably find it and put it in the chat, or I'll email it to you.
Okay, perfect. Yeah,
I'll email it to make sure you have it. But it's a lot of good information, and what's nice about that is people share their own experiences, and we get to kind of talk and help each other. So people kind of will say, like I said, the person mentioned about their mom and sundowning. They'll have different questions like, what do you all think about this? So it's just another good place to go to kind of have safe conversation about what your experience is.
Yeah, this is very helpful. Yeah. And when you mentioned the sundowning, I'm like thinking back with my mom, I'm like, whenever it starts getting dark and the blinds are open, she's like, I need those closed.
Yeah.
Yes. So I try to remember, okay, when it gets dark, close those blinds because that just does something for her.
Yeah.
And I'm like, okay, I'll close them, sit still, but if they're not closed, she's like, she's looking. Yep. And I'm like, it's sort of like an agitation.
There comes a point though when day and night is totally flipped, because that's where my mom's at.
Yeah.
So I mean, closing the blinds is good for a while, but then they hit that next stage and it's totally flipped.
Yeah.
I know when you were talking about your friends, and how with your friend that has dementia and how some of the other friends, I know sometimes it could be where they're thinking, okay, I don't really want this person telling me what to do. So when she was saying that, maybe try to figure out a different task for that person. And that's what I sort of have to remember, like for my sister and I, or even with my aunt, because sometimes she gets irritated with my aunt. I'm like, okay, what can we
that's
figure?
What's happened. That's exactly what the problem is.
Yes. So definitely challenges, but that makes that very helpful information. Sort of makes me rethink some things as far as how we do things. So
Lita, one question. Can you share or put in an email the video slide that you had so I can send it to some of the other friends that didn't make it?
Yep. Absolutely.
Okay. Oh, that would be awesome. Yeah, because I was telling a friend about it, and for her mom, because her grandmother has it. And so they're actually, when you were talking about self-care, her mother's actually able to get away and, do some self-care. They're going out of town and just, really enjoying. So I would love to be able to share. She said she would love to have joined, but they were getting ready to travel. Okay. So I would love to share that with her so she could just see exactly, what you offer. So that would be great.
Awesome. I sure will. Yeah. All right, ladies. Well, thank you.
Yes,
thank you so much.
Thank you.
All right. Have a wonderful night.
All right.
You too. Bye-bye.
Bye.